If you have severe back pain, the biggest mistake you can make is assuming it's a disc problem. Most people don't realize facet joint pain and disc pain feel almost identical, but they require completely different treatments. Get the diagnosis wrong, and you'll spend months chasing the wrong fix while your pain stays put. In this video, I'm going to show you the exact patterns that separate facet joint syndrome from disc pain. You'll learn what each one actually feels like, how to recognize which one you're dealing with, and what treatment to ask for so you get results instead of spinning your wheels. By the end, you'll know which pain you have and exactly what to do about it. Hi, I'm Dr. Zielonka. I'm a neurofunctional chiropractor in Ottawa, Ontario, Canada. My YouTube channel focuses on helping those who've been suffering from debilitating chronic back and neck pain. Before I dive into today's video, I need you to smash that subscribe button if you want to learn more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs, without surgery. I upload a new video every week. Before I dive in, I need to mention that this video is not meant to diagnose your pain or your condition, and it does not replace the role of your primary healthcare provider. Severe back pain can have multiple causes, and the only way to get an accurate diagnosis is to be properly evaluated by a doctor who understands these conditions well. Always get checked by a qualified healthcare professional before making decisions about your care. If you're trying to figure out whether your severe back pain is a disc problem, you first need to understand the anatomy called the facet joint. So this structure behaves very differently than a disc. The facet joint is a small stabilizing joint between the vertebrae above and between the vertebrae below. So each motion segment in your spine has two of these, one on each side. These joints are enclosed in what we call a ligament capsule, and together with your back muscles, they allow your spine to move in multiple different directions: flexion, extension, lateral flexion, rotation, or what some people refer to as side bending for the lateral flexion. They guide movement and they limit excessive motion so your spine stays stable and it moves smoothly. Facet joint syndrome develops when it's these joints, the facet joints, that become irritated. And there are several common ways that this can happen. One of the most frequent causes is what we call spinal misalignment. Now, this is not about dramatic shifts or something being completely out of place. It's a restriction in how the joint's position or how it's functioning. When the joint does not glide the way it should, mechanical stress increases inside that small capsule. The cartilage will start to wear, the joint begins to load unevenly. That's the beginning of that irritation. Degenerative changes are another major contributor. Spinal arthritis will develop, bony spurs will form around the facet joint. Over time, this creates inflammation and mechanical irritation. The joint space will narrow, the movement becomes less smooth, that irritation builds and builds. Chronic postural displacements also play a role. This could be a rounding of the lower back, a significant shift to one side, and unleveling of the pelvis and the sacrum. These subtle but persistent patterns overload one facet joint more than the other. Over months or years, that imbalance will start to create a problem. What happens is that imbalance is going to sensitize that joint capsule and it's going to become reactive. And then there's trauma, a fall directly onto the back, a hit from behind in sports, a sudden extension injury. All of these mechanisms share one specific outcome. They irritate the joint capsule surrounding that facet joint. That capsule is highly sensitive to injury. It's also highly sensitive to chemical irritation from inflammation. So when it becomes irritated and inflamed, it sends very clear pain signals, resulting in localized back pain that is often sharp or aching. And here's the tell sign. Facet joint pain gets worse with extension movements. It's frequently worse with standing, leaning backwards, twisting. It's usually concentrated more on one side than the other. And here's another key detail. Facet joint pain never shoots all the way down the leg like a true nerve distribution pattern. The pain pattern matters because disc pain does not follow the same rules. The disc is where most of the confusion really begins, because when you get an MRI and it shows a disc bulge or herniation, that single image can make you believe you've found the source of your severe back pain. Let me let you in on a secret here. There has been study after study after study that have shown people with significant disc injuries who have no pain whatsoever. And there's been study after study after study that shows the exact opposite. People have no disc herniation, yet they have significant pain in there. A disc bulge or herniation happens when that cushion between the two vertebrae begins to push outward or tear. Most commonly in L4, L5, or L5S1, these levels absorb the most load in the lower spine, so when they degenerate, people notice it. And when an imaging report mentions one of these levels, that becomes the focal point. People assume that that must be the problem, that must be what needs fixing. Sometimes it is, but disc-related pain can absolutely be localized. You can feel deep aching pain right at that level. It can be centralized and intense. And because it can feel that way, it gets confused with facet joint syndrome all the time. Both can create localized back pain, both can feel sharp or aching. That's why anatomy alone does not tell the whole story. One of the big differences is that disc pain has a distinct pain distribution pattern. The disc sits directly next to the spinal nerves, so when a bulge or herniation compresses or chemically irritates one of those nerves, the pain does not stay in one place. It travels and it follows the path of that nerve down the leg. That's when you see the classic disc pain presentation. Pain's going to shoot down the leg, it radiates into the glute, it spreads down into the thigh, sometimes traveling all the way below the knee and into the foot. The pain may feel sharp or electric, or it might even feel burning. Often it comes with numbness or tingling in that same pathway. That leg pain pattern is the defining behavioral signature of disc-related nerve compression. It's specific and it's reproducible. Disc-related pain is also triggered differently. It's usually worse with prolonged sitting, bending forward, or activities that increase pressure inside the disc. Coughing or sneezing can definitely aggravate it. Sometimes even laughing will trigger it. Those pressure-based triggers are far more common with disc involvement than they are with facet joint irritation. Facet joint pain, by contrast, typically feels worse with extension movements. So that's going to be leaning back, standing too long, twisting. These are the positions that load the facet joint directly. So here's the critical point. Disc pain can stay local sometimes, but when nerve compression enters the picture, the pain pattern changes dramatically. It spreads, it radiates, and it follows a clear neurological pathway that you can actually trace on your own body. Once you understand how each structure behaves under different movements and pressures, the real separation between facet joint syndrome and the disc-related problem become unmistakable. Now let's talk about treatment. If facet joint syndrome is truly the source of your severe back pain, then the treatment strategy has to address the joint restriction itself, not just the inflammation and not just temporary symptom relief. You have to address the underlying mechanical dysfunction that created the problem in the first place. The best treatment for facet joint pain is one that restores proper motion and improves spinal joint function. One of the most effective methods of doing this is chiropractic spinal adjustments. A chiropractic adjustment targets that facet joint problem at its source. When a restricted joint is adjusted, motion is restored to the segment, the vertebrae begin to move the way they were designed to move, the joint starts gliding smoothly again, pressure comes off the nerve, inflammation comes down. That improved motion changes everything. When that restriction is removed, the joint capsule is no longer under constant mechanical stress. The irritation stops being reinforced every time you move. This gives the capsule a real chance to finally heal. Inflammation begins to settle, swelling reduces, the chemical irritants created by the inflammatory process can clear out of the joint space. As normal movement returns, those nerve endings in that capsule stop firing pain signals constantly. This is why chiropractic adjustments have been a cornerstone treatment for facet joint syndrome for decades. They're not masking the pain with medication. They're not just reducing inflammation temporarily. They're addressing the mechanical cause of the irritation. They're getting to the underlying cause. They're restoring the function that was lost. And because the facet joint responds so directly to motion restoration, improvements often happen relatively quickly once the restriction is corrected. People typically notice the difference within days or weeks. But here's a critical distinction. This mechanical approach to treating facet joint pain works specifically because the problem is a mechanical one, a restricted joint, uneven loading, loss of motion. Chiropractic adjustments restore that motion. Disc-related pain, by contrast, requires a completely different treatment approach because the source of irritation is different. The mechanism is different. The way the tissue heals is different, which is exactly why getting the diagnosis right matters so much. When you're dealing with disc-related pain, especially disc bulge or disc herniation at L4-5 or L5-S1 or any other level with pain shooting down the leg from nerve compression, the treatment priority shifts completely. The problem is no longer just joint restriction. The problem is pressure inside an injured disc and chemical irritation around the spinal nerve. This is a different tissue problem. It requires a different approach. Chiropractic spinal adjustments can still be useful, and we do use them when treating disc bulge and disc herniation patients, but restoring motion to the surrounding spinal joint, it's going to help overall biomechanics and will reduce that secondary stress on the disc. But there's one specific thing that an injured disc truly needs in order to heal. That's reduced pressure. That's where non-surgical spinal decompression comes in. Non-surgical spinal decompression is designed to gently and progressively reduce pressure within the injured disc. By creating controlled decompression of the spinal segment, the treatment lowers the pressure building up inside the disc itself. That reduction in pressure can decrease mechanical compression on the nerve and create a more favorable environment for the disc tissue to actually recover and to repair. What spinal decompression does, or true spinal decompression, is it creates negative pressure in the disc. That's actually the key do all of this. Traction will never do this. Inversion will never do this. A lot of standard spinal decompression tables sometimes don't do this. You need true spinal decompression. The goal is not aggressive force. More is not always better. It's precision and consistency. When disc pressure is reduced systematically, inflammation around the nerve can calm down. As that irritation decreases, the classic disc-related pain pattern, especially pain shooting down the leg, often begins to centralize and improve. So centralized means it's coming back to the spine instead of coming down the leg. Pain that was radiating now stays closer to that source. So pain intensity will decrease, and as healing progresses, it often resolves completely. In my clinic, we use an advanced and unique form of this treatment called non-surgical robotic laser spinal decompression. This approach combines two modalities simultaneously: mechanical true spinal decompression and class 4 robotic laser therapy working together. The decompression component works to reduce pressure within the injured disc and relieve mechanical stress on the affected nerve roots. The class 4 laser works at a cellular level. It's going to increase blood flow to the injured tissues. It supports active tissue repair. It helps reduce inflammation in and around that injured disc and the surrounding soft tissues that got irritated from the nerve compression. By combining mechanical unloading with targeted anti-inflammatory and healing support, the treatment addresses both the structural pressure problem and the inflammatory component that drives disc pain. Here's what matters most. When you match the treatment to the true pain pattern, outcomes improve dramatically. A treatment designed for facet joint restriction will not fix disc pressure. A treatment designed to reduce disc pressure will not restore facet joint motion. They are addressing different problems. And that's exactly why correctly identifying the difference between a disc problem and a facet joint pain is not just academic information. It directly determines what kind of treatment is going to give you the best chance at real lasting relief instead of months of treating the wrong problem. That's why, even though we have the best technology in the city, bar none, for treating these conditions, it all starts with a proper examination. How on earth do you fix something if you don't even know what it is? Now, I hope you have a clear understanding of the difference between facet joint syndrome and disc-related pain. As you can see, they both require a thorough assessment and accurate diagnosis and targeted treatment that matches the actual structure causing you your severe back pain. When you treat the right problem with the right strategy, outcome improves. When you guess, recovery gets delayed. If you found value in this video, please like it and please share it so more people struggling with back pain can better understand what they're dealing with and stop chasing the wrong fix. If you have any questions, drop them in the comment section below. And remember to subscribe if you want to learn more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs and without surgery. If you're looking to avoid back surgery for disc bulge or disc herniation, check out this video here next, where I show you how non-surgical robotic laser spinal decompression fits into our 7-step treatment process for L4-5 disc bulge, L5-S1 disc bulge, and how we approach disc-related pain in a structured and comprehensive way.